I will remain in self-isolation for 14 days.
These are extraordinary times, and that means we are ready to take extraordinary measures.
Today, my advice is to postpone or cancel all non-essential travel outside of Canada.
Those overseas international flights coming into Canada are going to be restricted to a smaller number of airports.
The spread of the coronavirus is having serious consequences for Canadian families and for Canada's economy.
The actions that you will take today will save lives. Wash your hands. Stay home if you're sick. Cough into your sleeve. Make sure that you're following the important public health measures that we've been talking about for months, and you will be playing a critical, important part of containing the virus.
Canada's Chief Medical Officer of Health advises Canadians not to travel outside of Canada. The Prime Minister addressed Canadians while in isolation at his Ottawa home, and a major move by the Bank of Canada today as it reacts to fast-moving developments with the coronavirus outbreak. This is Power and Politics, and I'm Vashi Kapelos. As Canada confirms more than 180 cases of COVID-19, with almost 80 cases in Ontario and 56 in BC, Saskatchewan has just announced its second case. We've got a lot to update you on as the government ramps up its response to the coronavirus pandemic. The Prime Minister spoke today from his own self-isolation, or quarantine rather. Take a listen.
I know that you're worried. You're worried about your health, about your family's health, about your job, your savings, about paying rent, about the kids not being in school. I know that you're concerned about uncertainty in the global economy. The steps being taken to keep you safe have an economic impact. But what is also true is that we are in the enviable position of having significant fiscal firepower available to support you.
This afternoon, the Prime Minister also spoke by phone with his provincial and territorial counterparts, as well as Indigenous leaders, to reassure them that federal funding will be available to help them navigate expected pressures on both healthcare systems and the economy.
I understand that it will be a major problem for many parents starting Monday morning to find a place for their children. I understand very well the problem. What I'm asking is kind of solidarity coming from the family, neighbors. We need to take the decision that is the less worst for the population, and we think that this is the decision to take.
Premier Legault is referring to one of the big announcements that came out of this country where coronavirus is concerned. Quebec schools from daycare to universities are now shut down for 2 weeks. That, of course, follows Ontario's decision yesterday to extend March break in that province for 2 weeks, with some economists predicting a recession. First this afternoon, the Finance Minister and Governor of the Bank of Canada jointly announced measures to reassure Canadians that the economy is positioned to weather the fiscal fallout. Here in Ottawa, the House and the Senate have both been shut down before leaving. MPs from all sides came together today to quickly pass the new NAFTA. But we want to begin with the government's decision to tell Canadians to avoid all non-essential travel outside of the country and to funnel international flights to fewer airports across provinces. Jean-Yves Duclos is the president of the Treasury Board and the vice chair of the Special Cabinet Committee on the Coronavirus Response. Hi, Minister Duclos. Nice to see you again. Thanks for coming back.
Thank you, Vashi. Always pleased to be here.
Let me start off with that advisory. Dr. Tam got up to say today and said, our advice is to Canadians, don't travel outside of this country. Why is it just advice? Why is it not a formal advisory?
Well, it's absolutely essential to understand that this is an advice not to travel outside of Canada, except for absolutely essential purposes. And the reason for that is that the advice of our experts, our public health experts, is quite clear. The fact that the contagion is changing rapidly outside of Canada, that more countries are involved, that is signaling the fact and the important advice that we need to be very mindful and stay in Canada and look after one's health.
Again, I take the point that you're making, but it appears to me that this is advice being given. It's not a directive. It's not formal. And I'm asking because a number of Canadians, since this announcement was made, have reached out to me saying, well, my insurance company isn't covering me, or I'm not getting a refund from my airplane because they say it's just advice.
Well, it's advice, and we expect it to be listened to. because when people travel abroad, not only do they become at risk of being infected themselves, but when they go back home, they also are at a risk of having to be put into self-isolation and also not being able to work, and of course the risk of contagion.
Yeah, I understand the point that your government is trying to make and what you're trying to protect here. I'm just wondering if you're considering making it more formal or issuing a formal directive so that people who have had to cancel their travel plans as a result of this are able to recoup some of the money they lost.
Well, of course, that situation is evolving, and we might need to get there at some point. All options are open, but again, based on the advice of our experts now, that's what is appropriate at this time.
Did your government wait too long to make this recommendation? 24 hours ago, you sat in this chair and I asked you, why isn't there a national directive on the issue of travel, considering everyone's about to go on March break and some provinces are saying don't travel and others aren't? You said, well, the situation is different depending on the province you're in. 24 hours later, your government is issuing a national piece of advice.
Well, there was an advice yesterday, and the advice was you need to be very cautious if you travel to some particular countries. Now the advice is much larger. You need to be careful and cautious when you decide about traveling to any country outside of Canada. So that advice has been, of course, strengthened, and the reason is that the situation is still changing.
So the situation in the last 24 hours has changed so dramatically that this was necessary. Is that the point of view of the government?
That's the advice of the experts.
And what about travel within Canada? Again, a number of Canadians after that announcement reached out saying, am I still okay to go to Montreal for a March break, or should I just be staying put? What is the advice of the government on that?
Well, I think Canadians need to understand and need to understand increasingly well that wherever we are in the world, including in Canada, we need to be very mindful of basic hygiene measures, both personally and from a community perspective. And that involves looking after the health of people we happen to live with or to work with. So it's true for everyone. What we call social distancing applies whether you are staying in the same community or whether you're traveling outside of your community. So these basic issues of hygiene and protecting yourself in a social context apply whether you stay at home or whether you have to travel around your home. Again,
but take the half out of it. Take people who are, again, wondering about March break and who are saying, well, maybe I'll just have a vacation somewhere else in Ontario or I'll go to Quebec. Should they?
Well, they can, but whether they decide to do so or not to do so is not the only answer and the only question to ask. It's also, what do you do if you stay in your community versus if you travel? Because even if you stay in your own community, in your city, in your village, you need to apply basic measures to protect yourself.
Social distance, right? That's what your government has been talking about. We've heard that from public health
and that's
officials.
valid whether you travel or don't travel within Canada.
But can you have social distance on a plane?
Well, of course, the plane situation is a lot more difficult and challenging than if you travel in a car. So if you travel by car from, say, Ottawa to Montreal or Toronto to Windsor, you'll be in a different situation than if you take a plane. So we understand and we know that people will exert their best judgment as how to protect themselves and those that they love.
The Prime Minister announced today that international flights, the number of international flights and travelers coming into Canada, will be restricted to fewer airports. Where are those airports and which international travelers?
So two things. That's an important measure, which is going to make it more easier and better for our services, screening services and public health services to be delivered in an efficient manner. Now, the second thing is that the more and the important details around that announcement will be known very soon.
When?
I would expect in the next hours or so.
So you think today we'll find out exactly what that means? Because your government made the announcement today that it's going to happen, you just provided no details.
It will happen, and for that to happen appropriately, we need, A, to make sure that this is happening in a proper legal and formal context, and B, it needs to happen in coordination with airport authorities. So we need to take a little time, not a lot of time, but a little time to work with them so that it happens in the appropriate manner.
Will it include travelers from the United States?
You'll have to see the announcement soon, but it will be as I said, in a manner which will guarantee that our investments in border security and in public health services will be more effective.
And we will know the details of that by the end of the night? Is that what you're saying?
Well, I'm saying in the next hours, and of course it depends on the ability of the Transportation Minister to do whatever he needs to do to make that not only happen, but appropriately enforceable.
The Finance Minister today made a big announcement, as well as the Governor of Canada. Obviously a lot of concern where the economy is concerned. What was missing from today's announcement was some kind of help for people, and I think we've spoken about this before, but people who, as a result of schools shutting, as a result of feeling unwell, aren't necessarily diagnosed with the virus, aren't quarantined, but have to take sick days. Their employers perhaps might not be able to cover the amount of sick time, or any sick time at all, that they have to take. There was nothing in the announcement today that is directed at those individuals. When will the government help them, and how?
Yeah, you're correct. Today's announcement was about helping businesses stay alive and avoiding laying off people in large numbers, which would be terribly bad given that we want this situation to be a short-term situation. But the Minister of Finance also said that very shortly, probably the beginning of next week, there will be important announcements to support individuals and more particularly vulnerable Canadians of the types you described, so that they can look after themselves and also happen to have the resources that they need to pay for rent and food in the next weeks.
And will that be, and the Prime Minister got a question on this, will that be direct payments? Will that involve, so for example, I have to stand with my kid, I can't go to work, I don't have sick day coverage, I can't pay the rent. Will the government help me pay my rent?
We've already announced measures of that sort last
Well, actually,
Wednesday.
those only apply to people who are under quarantine or have been diagnosed with the virus. I'm talking about someone who just has to stay home with their kid.
But also those that were asked to go, or asked by either their employers or their public health officials to stay home. But as we know, this is not covering everyone, because there are some individuals who are not EI, employment insurance eligible. But the Minister of Finance is obviously working on this. He's announced that recently, and there will be more to come very soon.
Okay, we'll be watching for that. Thank you, Minister Duclos. I appreciate you making time for us again this evening.
Thank you, Vashi.
That's President of the Treasury Board, Jean-Yves Duclos. To recap, a lot of news on coronavirus throughout the day. I want to make sure that you have the most up-to-date information. First of all, as I said, Canada has said don't travel. The advice from Dr. Tam is don't travel outside of this country. If you do, you've got to self-isolate when you come home. We also just spoke to Treasury Board President Jean-Yves Duclos, who reiterated that the federal government has decided to restrict international travelers and international flights to a smaller number of airports. We don't know which airports, we don't know which travelers or which flights, but that information, he says, is going to be made available in the coming hours. There's also a big announcement from the federal government where the economy is concerned. The Bank of Canada has cut its key lending rate for the second time in 2 weeks. It now sits at 0.75%. And Bill Morneau, the finance minister, announced $10 billion in credit for businesses, as well as a change to the rules around how much liquidity banks will have, so how much money they'll be able to lend out in this situation. He also says, and this is something to really watch for, that next week there will be a significant stimulus package introduced by the federal government. We don't have details on exactly what that will mean, but that is said to be coming early next week. This is all happening against the backdrop of something extraordinarily personal for the Prime Minister. His wife, Sophie Gregoire Trudeau, last evening got the results of a coronavirus test back, and they came back positive. As a result, she is self-isolating for 2 weeks, and the Prime Minister will also be in isolation for 2 weeks. He spoke outside of where he lives at Rideau Hall a little bit earlier today. Have a listen to what the Prime Minister said.
Sophie's symptoms remain mild, but we are following medical advice and taking every precaution. She will remain in isolation for the time being. We are thinking about all the families across the country who've received the same diagnosis. But we're in good hands. We have full confidence in Canada's health officials and professionals. This means that, upon my doctor's recommendation, I will remain in self-isolation for 14 days. I want to be clear, I have no symptoms, and I'm feeling good. And technology allows me to work from home. Of course, it's an inconvenience and somewhat frustrating. We are all social beings, after all. But we have to do this because we have to protect our neighbors and our friends, especially our more vulnerable seniors and people with pre-existing conditions. We are following medical advice, as should all Canadians.
So again, that's Prime Minister Justin Trudeau speaking outside of his residence a little bit earlier today, confirming that Sophie Gregoire Trudeau's he tested positive for COVID-19. The Prime Minister says he has not taken a test because on the advice of his doctors, he doesn't need to unless he shows symptoms, and he is not showing any symptoms. He also says that his wife, himself, and his kids are all feeling well. There are, though, a total of more than 180 cases of COVID-19 confirmed in Canada. Public health officials are telling Canadians, as we've been reporting, to avoid all non-essential travel outside the country. It is an extraordinary time in this country, some extraordinary circumstances. We wanted to get some perspective from someone who has been through another extraordinary time in this country during the SARS crisis. Former Federal Health Minister Anne McClellan. Ms. McClellan joins us now from Edmonton. Hi there. Thanks for making time for us this evening.
My pleasure. And how are you?
I'm okay. And
Good.
Yourself?
Just fine. Thank you.
That's good. I'm glad to hear you're in good health. I wanted to start off just because you spent a lot of time in government. I know also in various capacities you've worked with this government. Your sort of, bird's eye view, your perspective on how really extraordinary this time is.
I think it is an extraordinary time, certainly as Federal Health Minister during SARS. I have reflected back to that time virtually every day since COVID-19 was first became a thing. And I am struck by the improvements in our public health preparedness. I am struck by the level of cooperation and information sharing between the Government of Canada, provincial and municipal counterparts. I am struck by the fact that the WHO got on the ground early in China. Yes, we can question, the degree of transparency, certainly initially, but I have taken the time to reflect on how much has changed, but truly, I think the response of our country and others around the world to COVID-19 is really something that we have not seen before.
Yeah, I wanted to delve into that a little bit with you because especially today, we've seen throughout the week just a massive sort of evolution of this whole issue, but also an evolution of the response to it. And that almost seemed to be really punctuated today with the announcement from the federal government, the advice from Dr. Tam, don't travel outside of this country, for example, or the new restrictions that the federal government is going to place on international travelers. When you were going through everything with SARS, were you considering restrictions like that? What were the considerations?
Well, we did, in fact, consider the movement of people. Keep in mind that the WHO imposed a travel advisory on the city of Toronto, which was devastating to the economic well-being of that city for some considerable period of time. So, yeah, we were considering people coming and going. And one of the things that is absolutely key for the WHO when they look at a country and how well a country is dealing with an infectious disease is whether you're containing it in the sense of not exporting cases to the rest of the world. And I do believe we never exported a case of SARS to the rest of the world, which tells you that, in fact, our surveillance, such as it was at the time, but the containment practices, especially in the city of Toronto at great personal cost to frontline health professionals, was actually pretty good. And it's so much better today than it was then. But yeah, sure, you have to look at the movement of people because the disease, it's the people, it's the human beings and where they are in terms of how the disease spreads. And but I would say that one of the things we did, because it wasn't always clear to us, even what kinds of questions could we ask people coming, say, into an airport like Vancouver, and for how long could we detain them, the authorities of the screening officers, then the quarantine officers at airports or land border crossings. And all of that was dealt with when we reformed in 2004 the Quarantine Act. So it is absolutely clear today the powers of the Minister of Health and some others in the government in relation to making sure if people are traveling, what you can do with those people when they show up at an airport airport or a land border, the questions they must answer, and how those people would be dealt with if they were symptomatic.
When you refer to containment during SARS, I'm wondering, I feel as though that's something a lot of Canadians are thinking about right now, especially those who were planning to go on March break, let's say, or who are worried about losing money after they, planned that trip, or who are worried about not being covered for sick. I mean, there are really genuine concerns out there, I think, about the types of decisions we are all now expected to make. And I'm wondering what your message to Canadians is, because you see the number of cases, and 180 isn't nothing, but it's also not what we're seeing in other countries. And the message from the government is we've got to do this now in order to avoid more cases later. But that can be difficult to rectify, I think, for Canadians who are kind of suffering some immediate personal costs.
Yeah, I think that's true. First of all, I would say that I think the government is right at all levels of government to remind Canadians to follow the best advice of their public health officials. And we all know what that is in terms of, washing our hands and sneezing into our arm or all those kinds of things. I am sympathetic, obviously, to Canadians whose lives have been turned upside down. For example, it's a small example, and I'm not asking anyone to be sympathetic to me, but I was taking my grandchildren on a Disney cruise, March break, starting March 27th, here in Edmonton. Well, obviously, we're not doing that. I canceled the cruise. I was lucky enough to have insurance, so I'm not out dollars and cents, but I realize, and I think government also takes on board the fact that the more restrictions you impose on people, the more disruptive it is of their lives, their families, their places of work, and ultimately the economy. And that is why, for me, it's always a case of balance. You don't want to underreact to a public health crisis, but you also don't want to overreact because of the huge disruption. And the government has decided, based on the best evidence it has, that in fact, the best advice for all of us is not to travel outside the country. When you return to the country, or if somebody comes, a foreign national to this country, 14 days of self-isolation.
Do you think sorry to interrupt just for a second, do you think they could have, and I ask this only because the provinces started giving out that advice a bit before, do you think they could have issued that at the national level a bit earlier?
I think what I would say is that I think one of the lessons, one of the questions I would ask in a lessons learned exercise after we are through with this is whether or not all those restrictions in terms of gatherings over a size and so on, whether actually they achieve the public health objectives that we want. And I don't know the answer to that. It's a question. It's a big question for me that I hope we get more and better information on after we have time to reflect. Does it actually achieve a public health purpose to tell people, well, you can tell people to be cautious, obviously, that's just common sense, in terms of leaving the country or even traveling within the country. But when you consider the disruption to the economy and families and so on, is the public health benefit actually there? I don't know the answer to that question, and I think it's a question that the world should really look at very carefully in terms of what are the best mechanisms to contain and surveil and keep a population relatively safe.
Yeah, my guess is, and you bring up an interesting point, because I remember yesterday when I think it was Dr. Henry who was saying out of BC, we've decided to ban basically public gatherings for people over 250, and she admitted that's kind of an arbitrary number, that there's no scientific basis to it, but the message that they're trying to disseminate is the idea of social distance. So they're trying. She described the idea of like trying to put in other things in place that would emphasize that idea and make it sort of a little bit easier to make the decision on the behalf of people. And my guess is if you're in government, and you obviously know better than I do, but you want to err on the side of, even if we're not, we don't know for sure this works, let's try if the public good outweighs the risk.
That's right. And this country has done an exceptional job in terms of containing the spread. And the number of cases is far below that of many other nations. And actually, some of those nations have taken more draconian European measures, for example, Italy, and now, of course, our neighbors, the United States. So I think it will be interesting going forward after this is over and we have a chance to reflect as to what are the measures that actually are effective, as opposed to being politically attractive, if you like. What are the actual measures that ensure that you are doing the surveillance, you are containing the spread, and making sure that that information, that your public health officials are doing everything they need to do around keeping people safe. And keeping people safe is really about, yes, the individual, but also containing the outbreak so that it does not spread beyond either a certain group, a certain community, whatever the case may be. I will say that I think Canadians should be reassured at all levels of government, and that does not mean complacency, because we know we need to be careful, we need to be cautious. But you know what, Vashi, some of the best public health tools are each one of us taking on board those warnings. And I'm sure, you know, our eyes have started to roll. We've heard them so many times, but they shouldn't, because we can't be complacent. And we, as individuals and in our families, can play such an important role in keeping each other safe, keeping ourselves safe, and making sure that you're flattening that curve.
For sure. Flattening that curve. That's what we keep hearing. Thank you so much.
Right.
Yeah, thanks for your insights this evening, Ms. McClellan. Pleasure to have you back on the show.
My pleasure. Thanks.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.